What do positive autoantibody tests mean for lupus prognosis? When we talk about positive autoantibody tests in lupus, we are diving into an important aspect of understanding this complex autoimmune disease. Lupus, or systemic lupus erythematosus, is when the immune system mistakenly attacks the body's own tissues. Autoantibody tests help identify specific antibodies that indicate this autoimmune activity. One of the most common autoantibodies tested is the antinuclear antibody, or ANA. Over 95% of lupus patients test positive for ANA. While a positive ANA is sensitive, it is not specific to lupus. This means it can show up in other conditions or even in healthy individuals. So, while it supports a lupus diagnosis, it does not give a clear picture of prognosis. Next, we have the anti-double-stranded DNA antibodies, often referred to as anti-dsDNA. These antibodies are more specific to lupus and are closely linked to disease activity, particularly kidney involvement. High levels of anti-dsDNA antibodies often indicate a more active disease and can predict potential flares or worsening organ damage. Another important autoantibody is the anti-Smith antibody. This one is highly specific for lupus and generally confirms a more definitive diagnosis. However, its presence does not necessarily indicate the severity of the disease. There are also other autoantibodies like anticardiolipin antibodies and anti-Rho SSA antibodies. Interestingly, positive anticardiolipin antibodies have been linked to a higher chance of sustained remission in some studies, suggesting a potentially better prognosis for certain patients. In active lupus, low complement levels, specifically C3 and C4, often accompany positive autoantibody tests. These low levels reflected immune complex formation and can indicate disease activity and risk for organ damage. So, what does all this mean for prognosis? Positive autoantibody tests confirm the autoimmune nature of lupus and help identify specific disease patterns. High levels of certain autoantibodies, especially anti-dsDNA, are often associated with more active disease and a higher risk of organ involvement. This can worsen prognosis if not managed effectively. On the flip side, some autoantibodies may indicate better outcomes or sustained remission. This shows the diversity within lupus, as each patient may experience different disease patterns and responses to treatment. Monitoring autoantibody levels and complement proteins regularly is essential for tracking lupus activity and the effectiveness of therapy. Positive autoantibody tests requiring a thorough clinical evaluation and ongoing care from specialists to manage symptoms and prevent complications. Treatment decisions, including the use of immunosuppressive medications, are informed by these autoantibody profiles alongside clinical assessments. Overall, while positive autoantibody tests are crucial diagnostic markers, they provide insights into disease activity and prognosis. It is vital for patients with lupus to have regular follow-ups with their healthcare providers to tailor management based on their specific autoantibody profile and disease course.